today I'm going to be doing palpations of the face and the head and a few special tests with my patient. So first I'm going to palpate the frontal bone, which is going to be along the forehead right here, patient. And then you can come down and palpate their temporal bone, which is going to be right here. And as you come down, follow that, and right here you're going to have your zygoma, and that's going to be right along here. And then you'll get your mandible down here. Then right here you have your TMJ, and so you can palpate that a little bit easier if my patient will open her mouth, and you can feel it move, and you can close that again. Good. And then you'll have your parietal lobe up on the top, down, and just palpating the rest of the skull down to the occipital lobe. Then you also have your cheekbones right around here, so your zygoma and your maxilla, which are going to connect right about here. Next, you'll have your nasal bone, so that'll run down here and connect to cartilage right at the end. And then you also have your hyoid bone, which is going to be at the bottom right down here. And then, of course, your outer ears along here, and you can just look during inspection, mostly for those, palpate around that. Then for soft tissue, you'll have your temporalis muscle, which is going to be right up here, and you can feel it whenever your patient will chew or open their mouth, just like that, yes. And then you'll have your buccinator muscle, which is going to run horizontally right down here and connect to your other muscle that is going to run vertically right up here. And then next, we're going to do a few special tests. So the first one is going to be the Romberg test. So I'll just have my patient stand with their feet together, and you're going to put your hands on your hips and close your eyes. And you're going to look for any swaying or unbalance that the patient has. And a positive test would be if there is swaying, and you can go ahead and open your eyes. Some swaying or imbalance due to a concussion. The next one I'll have them do is the tandem gait walk. So first I'll have my patient stand, and you're going to take about 3 steps, and you're going to put your heel in front of your toe and walk. And go ahead and do that with your eyes open 3 times. 1, 2, and 3. Good. And then you can go back and do it with your eyes closed. Just 3 steps. Good. 2, 3. Perfect. And so you're also just going to look for any imbalance with your patient there, checking for any cerebral damage or any damage due to a concussion as well. And then the third test is going to be the BEST test, and so that is also going to be testing for balance. And so you'll have 2 different stages. You'll first test your patient and have them stand with their feet shoulder width apart, and just have them close your eyes. And so they'll hold this stance for about 20 seconds, and you'll see if they sway back and forth or side to side at all. Good. And then the next position is you'll have them stand on one leg, and they'll hold that for about 20 seconds as well, and you can time that. And then the third stance is they'll put diagonally, they'll put their heel in front of their foot, and they'll stand like that for about 30 seconds with their eyes closed. Good. And then you'll do that all over again with their eyes open. And so if the patient cannot do that for at least 5 seconds, then that's a positive test for any cerebral damage. And that's it for today.